Hi there, Dr. Steve, and here is a median nerve mobility. So if you have a median nerve issue, and that might be like a carpal tunnel thing or some numbness and tingling into your hand and your fingers, some of the things that can be going on is that median nerve can be hung up and just not moving very well. So these are going to be a couple of moves that you can do to mobilize your median nerve. So what we're going to do is we're going to use my left arm as the demonstration, and this is going to be putting the nerve onto a tension position. We're going to stretch it, and then we're going to start to wiggle the body around. So we're going to have the fingers pointing down, and the palm is going to be on the wall, and you're going to lift your arm up just below where you feel any symptoms. A tightness down the front of the arm is pretty normal, but you don't want to be putting yourself in a painful, miserable position. But the fingers are down and the elbow is straight, the hand is on the wall. We're going to bring that same side foot forward, and your other hand is on your hip. So the hand stays there, and this is in the median nerve stretch position. And then we're going to move the pelvis and your hips, and we're going to get the spine going from below. So this is a bit more of an indirect mobility for the nerve. It's getting a stretch as we're moving the body around. You do some forward and back. We do some side to side with the hips. And as best you can, you're trying to keep that hand with the palm on the wall, the fingers pointed down, and the elbow mostly straight. So we do forward and back, side to side, and then I'm going to have you turn your whole body towards and away from the wall. And that is going to add the rotation component. So we're doing all of this, moving through the pelvis and the hips, doing an indirect mobility from the bottom up. Then we go from the top down and make this more of a direct mobility exercise. We're going to have the head nodding up and down in the sagittal plane, and you do about 5 of those. Then we tip ear to shoulder in the frontal plane, doing the side to side, and then we turn looking over each shoulder in the transverse plane. So then you let everything release, and that's going to be mobilizing your nerve as we put it on a stretch position and get the body moving from the bottom up, and then we get the body moving from the top down, and that's going to help free up the nerve's mobility to help you feel and function better. Keep moving, everybody.